Hello, thank you for tuning in. This is Science with Chris, and today I'm going to be doing a book review on Atul Gawande's latest book, Being Mortal. This book was written in 2014, and I've already done a book review on Checklist Manifesto by Atul, and I'm also going to be doing one on complications. But this book used the same concept using personal experiences as well as familial. He uses his father's diagnosis of a spinal tumor as well in this book. But he uses personal experiences to address specific issues in medicine. But this book specifically touches on end-of-life care, and I super enjoy end-of-life care, so this book was a really interesting and quick read for me. For end-of-life care, the book really goes and analyzes the quantity versus quality dilemma. And the quantity versus quality dilemma is best exemplified by Swedish physicians when Swedish physicians undergo something called a breakpoint discussion. And a breakpoint discussion is when the physicians come and convene and decide whether medicine should be used to extend the patient's life or medicine should be used to increase quality of life. And you can't really have both, because if you have too long of a life, near the end of your life, you're going to be required to be on a respirator, maybe an ICU, in and out of a hospital, polypharmacy. So you have a lot of different issues that are going to be hampering down your freedom and independence. So the second topic in the book was referring to patient autonomy. And this is best exemplified through Dr. Gawande's interactions and writings about Karen Brown Wilson. And Karen Brown Wilson is the originator of the assisted living facility. And this originated around the 1980s in Oregon. And the point of it is to give as much independence as possible to the elderly population. And with increased independence, you have an increased quality of life. The third point is increasing the understanding of patients' priorities with what they frame as quality of life. So depending if a patient thinks that's more important to be able to just watch football games or go to their granddaughter's wedding or be able to eat certain foods or not have to be in the hospital, depending on what the patient thinks is what they're living for or their purpose, should then frame around the way medicine can be provided to that patient. But the fourth and final topic that the book really stresses on is economic impact. 25% of Medicare is spent on 5% of the population in their last year of life. So Medicare last year was $600 billion, which means 25% would be $150 billion. 1 million seconds is 12 days. 1 billion seconds is 31.7 years. And so $150 billion, if each dollar was 1 second, it would be 4,755 years. And a lot of this, the book goes into is because of either cultural entitlement, that patients feel like they can be living as long as possible, or two, fear of suffering and ultimately death, not wanting to face the inevitable. This book really kind of throws out there that conversations need to really begin early. So talking about death, what they value in life, will help open up conversations. And the conversations are an easy thing to say, like to the camera right now, but doing them is really hard because it brings up a lot of hard emotions. The second thing the book's talking about is when they're living in senior nursing homes. The average annual rent is $32,000 with a sign-up fee, if you want to call it, between $60,000 and $120,000. So it's pretty expensive, especially given the fact that you're probably making $15,000 a year as a senior. There's a lot of expenses that are required near the end of life. So if there's ways that we can possibly make living as independent as possible, but still reducing costs while ensuring that we're having physicians in the proper roles, then we'll be able to tackle some of these bigger issues. One of the main takeaways from this book that I felt was to be like a geriatric physician, palliative care, hospice in that grouping, as well as nurses or PAs, because it's teamwork. Anyone who has a role in their end-of-life care really needs to be creative. There's physicians or new PAs, NPs coming through, come up with new solutions. And one of them was super exciting, which I'm going to talk about in a different video, but I wanted to just briefly touch on that for Atul Gawande's book. An amazing book, super quick read, really good insight on the future of end-of-life care and the direction it should be going. If you have any questions or comments, leave them in the comment section below. Also, recently I created a Facebook page, so if you can click right here, we'll see if I can make it work. And if you want to subscribe to more of my videos, click right here. As always, thank you for tuning in and listening to me talk, and I hope to make a new video soon. Thanks.